Hello and welcome. I'm Dr. Peter Holsman, a medical practitioner, naturopath and professional speaker located in Ashburton, an eastern suburb in Melbourne, Australia. This educational video will help you find out what you can do when, despite feeling stressed, fatigued or otherwise run down, all the conventional medical tests come back normal. Is it all in your head, or are there other scientifically valid tests that you need to have done? This three-part video series begins with a description of the many symptoms common to people suffering from fatigue-related illness. Some strengths and weaknesses of conventional medical testing are then explained, and the role of 5 functional medicine tests follows. These scientifically valid tests can help you understand the common underlying causes of such symptoms as fatigue, lethargy, poor concentration, brain fog, anxiety, depression, low libido, bloating, aching joints, salt cravings, and sleeping difficulties. And they're very useful when standard conventional medical pathology tests consistently come back as being normal. So what are these 5 top functional medicine tests? 1. Hair tissue mineral analysis. Number 2. DMSA chelation test. Number 3. Adrenocortex stress hormone profile. Number 4. An MTHFR gene test. And number 5. A urine amino acid profile. Today I'm discussing some really common symptoms that can be so debilitating that people often struggle just to get through the day. In this video, you will find out about some of the underlying causes of chronic health problems and what you can do about it. My clinic specializes in treating people suffering from stress and fatigue. Perhaps you or someone you know is like this lady who needs regular cups of coffee just to get through the day. Well, this is an interesting question because almost everyone can identify with some aspect of it. Have a look at this long list of symptoms. Do you suffer from any of them? Weight gain, tired, sluggish, cold, poor sleep, fatigue, muscle weakness, constipation, coarse, dry or thinning hair, poor hearing, reduced sweating, low libido, muscle aches, headaches, husky voice, memory loss, slow reflexes, dry rough skin, swollen arms or legs. Did I say memory loss? Just kidding. Anemia, erratic mood, brain fog. And these are just some of the symptoms. Now I want you to ask yourself if you can identify with some of these symptoms. And I find that this long list of symptoms is really common in people suffering from fatigue-related illness. Fatigue is commonly associated with all of that long list of symptoms on the previous slide. Who's heard of at least one of these diseases? Chronic fatigue syndrome, fibromyalgia, hypothyroidism. These are the medical terms for a range of health problems that are poorly explained by the medical model. This is a really important statement. Fatigue is now so universal that it is not even considered to be a health problem. It's just part of modern life. Conventional medical tests are essential to rule out common health problems such as anemia, thyroid problems, and diabetes. And they're certainly vital for an acute illness, for example appendicitis, a possible heart attack, or a broken bone. So do ask your local general practitioner to request a comprehensive set of blood tests, including your blood count, iron, thyroid, cholesterol, sugar, and vitamin D. So what happens when diagnostic tests come back normal? Symptoms haven't improved. More tests come back normal. The medical model hasn't worked. Why? Believe it or not, even with a range of symptoms, the number of people that end up with a diagnosis under the medical model are, in a sense, the lucky few. In fact, the people who often are diagnosed with fatigue-related conditions are the extreme cases. So what happens to everyone else? They end up having more tests done, and even these come back with nothing wrong. It is actually quite common for me to see patients whose fatigue has got worse, but test results are all coming back showing nothing, and the patient knows something is wrong, but doesn't know what it is. It was once described to me by a patient as, on the outside, you look good. On the inside, you are literally falling apart. So the question is, how is it possible that so many people fall through the cracks like this? Let's have a look at this slide. And there's a real problem with reference ranges, because reference ranges do not look to see if you're healthy, they just look and see, are you normal compared to other people being tested? And these tests are based on mathematics, specifically statistics and standard deviations. 95% of test results are normal. 2.5% of test results are low, hence abnormal, and 2.5% of test results are at the high end and also abnormal. These tests do not care if you are healthy. They just want to know, are you normal compared to other people being tested? And the numbers are based purely on statistics, not on optimal health. For example, let's have a look at a series of blood tests for iron levels in this tired young lady. But first, let me explain the numbers. Firstly, the amount of iron is measured, and this is the amount of iron floating around in the bloodstream. Secondly, the transport protein's transferrin saturation is measured, and you might like to think of a shopping trolley that starts off empty and then progressively gets filled as you walk through the supermarket. So some people will always have an empty shopping trolley, others will fill their shopping trolleys a little, others moderately, and some will even overfill it with shopping. So looking at the first two tests, they're both normal. The third test does show some changes. It suggests plenty of iron in the blood and transport protein levels. In fact, they're both increased. It's only the fourth result that shows a definite iron deficiency pattern. However, in my experience, an optimal level for ferritin, which is a measure of iron reserves, is actually over 60 and preferably over 80 for most people. Lower levels are frequently associated with fatigue, craving sweets, hypoglycemia, hair loss, and brain fog. Now, all blood test results are reported with reference ranges, and it can be very helpful to see where your results are in this range. Are they high, low, or somewhere in the middle? Are your blood test results at an optimal level or simply somewhere within a statistically normal range? This concludes video 1 of this 3-part online seminar series. Video 2 will shortly be available for you to access, so make sure to check your emails to receive updates. For further information, including articles and videos, visit my website www.treatfatigue.com.au.